and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Susan Lopez. She's an internal medicine physician, and she wrote the Kevin MD article, The Impact of COVID on the Hispanic Community. Susan, welcome to the show.
Thank you for having me.
So before we get into your article, I was wondering if you could share your story and your journey to where you are today.
Well, I'm Mexican American, originally from Chicago, actually the little village and Cicero area. Grown up in these communities all my life, and I've always wanted to be a physician, and luckily my family was supportive of that, and have continued to train in the Chicagoland area, which has allowed me to luckily give back to this community.
Wonderful. And you're doing internal medicine in Chicago. How has the pandemic affected you and your practice thus far?
Well, I'm a hospitalist at Rush University Medical Center. So early on, I think a lot of us were just very worried about how to prepare for the influx of patients that we were going to see. It's definitely from probably early March up until maybe June, early June, it was pretty much all COVID, all day, every day, taking care of hospitalized patients. And even in the step down unit, I think the only area I wasn't exposed to was the ICU. So it got to the point where you almost had to remind yourself what a heart attack and everything else looked like, because you just saw so much COVID.
So we're now speaking at the last week of July. How are things now compared to a few months ago?
Well, luckily the numbers in Chicago and the state of Illinois have remained relatively good. I know our positivity rate has remained under or at about the 3% level for the past couple of weeks. So definitely a lot less COVID within the hospital. A lot of people are coming back, especially after waiting for so long at home. So medically, much more complicated patients, but we are starting to see that slight uptick of patients coming in with COVID again.
So I want to get into your Kevin MD article, The Impact of COVID on the Hispanic Community. Can you walk my audience through that article and share the reasons why you decided to write it?
Yeah, I think in the thick of it, I think all of us, again, we're just very worried about how to prepare for that surge, to the point that it was one of those things that you just didn't even realize the makeup of the patient population until you were there. When I work nights in the hospital, usually I can kind of strategize the admission so that I'm admitting the Spanish-speaking patients. But then it got to be that there was no way I could admit all the Spanish-speaking patients. I had to split it up. And the reason for that was because we couldn't have in-person translators. So my colleagues would have to either use the phone, or if we got lucky enough to find an iPad, that seemed to work a little bit better for my colleagues. But it was one of those things where all of a sudden it was just Spanish speakers everywhere, and it just got to a point where it was a little overwhelming, and I just felt like I didn't know if that was out there. And at that point there was so much information coming from everywhere about the disparities that the Black communities were facing, and they hadn't seen too much on the Hispanic and Latinx communities. And so I just felt like I needed to put it down in writing and let people know exactly what was happening within the hospitals.
So can you share in more detail, what are some of the specific health obstacles that the Hispanic community is facing?
Well, I think in general, at first I started to listen to Spanish media just to kind of get in tune as to what messages my Spanish speaking patients were hearing. It was a lot of the same messages: stay at home, wash your hands. The messaging on universal masking wasn't as strong back then. But the reality was that when my patients were coming in, or when I was admitting them, one, a lot of them were very fearful that immigration was going to know that they were admitted, and we're going to know where to find them. The other thing too was they couldn't stay home, even though the message was continuing to ask them to stay home. They just couldn't stay home. They needed to go to work. They were essential workers in, driving buses, in our grocery stores, delivering food. So they just didn't know how to protect themselves despite those messages of staying home.
Sure. And from a policy standpoint, if you were in charge of policy, what are some of the ways that we could help the Hispanic community specifically during the pandemic?
I think we really just need to understand the social determinants of health, the things that are going to affect their behaviors. So if you don't understand those communities, you can't tailor those messages to the communities. I think they've done a good job about letting people know and really emphasizing that universal masking is going to help and is going to work. If it were up to me, I think we would continue to provide those very culturally competent messages. Probably from the very beginning, I wish that could have been done, but luckily it's starting to be done now.
Sure. So I'm an internal medicine physician and I practice in southern New Hampshire, and we do not have a high Hispanic population in my area. So maybe you can teach me, what are some of the things that I should look for behind closed doors whenever I meet a Hispanic patient, especially during the pandemic? What are some of the issues that I need to be aware of?
Yeah, I think for most patients, I think when we ask them to self-isolate at home, they may not understand what isolation means. So really breaking that down, it means trying to not share a room, definitely not sharing a bed, not sharing food, knowing what the makeup of the household is. A lot of them are going to be multi-generational homes. So if someone does get COVID, it's going to be really difficult if they do live in a multi-generational home, it's going to be really difficult for them to maintain those 6 feet of space or even have that isolated bathroom for that person or have them stay in one bedroom, in one bedroom. So kind of understanding what the household makeup is and what they understand about those recommendations about isolation, because you can alter some things. And luckily the city of Chicago does have some options for patients and families who don't have those options or can't fulfill those self-isolation practices at home. But really understanding the makeup at home is going to help you give better recommendations to them.
And are there any resources that you could share online where we could perhaps learn more about these issues?
Well, right now, no. Currently, I'm working with a family medicine practice on actually doing short YouTube videos in English and Spanish, providing resources specifically, at least to the Chicago area. But those will be coming out soon. At least right now, the city of Chicago does have a lot of resources available, and even an application you can download on your phone where you can enter in your COVID symptoms and know what to do, and give you resources on where to find food, information about help with immigration, where to find resources even for housing if you need to self-isolate away from family.
Sure. We're talking to Susan Lopez. She's an internal medicine physician in Chicago. She wrote the Kevin MD article, The Impact of COVID on a Hispanic Community. Susan, what's something that you know now that you wish you knew before the pandemic started?
I think I wish I would have known how much it was going to impact marginalized communities and ways to kind of, I guess, we work in internal medicine. You always want to, your goal is always to try to prevent disease. So I think knowing what I know now, I think I wish I would have known probably a little bit more about how these communities are receiving messaging. I really had no idea that social media and YouTube was going to play such a big part in disseminating information. So I feel like I've spent my entire life learning how to, treat patients. It's a little hard to get that information out there when I don't know exactly how to do it through those avenues.
And my final question, what is your take-home message that you want to share with the Kevin MD audience?
If I had to sum it up in one sentence, I think it's understanding the community you serve is going to help you better serve that community. Just understanding that community.
Well, thank you so much for sharing your insight and time, and thank you for being on the show.
Thank you.